Our next presentation today is from the DrugFree Wayne Partnership, which works each year to accomplish its mission statement through our members and the organizations they represent. The grantees and funded programs, as well as a diverse group of citizens and programs designed to address substance use disorder issues. Our membership has provided a stable foundation for 27 years in the areas of alcohol, tobacco, and other drugs. We have with us Dr. Carrie Mier and Megan Huffmeyer from the DrugFree Wayne Coalition Partnership. We'll listen to their presentation and then we'll be joined by all three for a question and answer session.
Hi, everyone. My name is Dr. Carrie Mier.
I'm Megan Broeker.
I'm Megan Huffmeyer with the Choice to Start team.
And we are here to present to you today about opioid trends within Wayne County. Megan and I both work with DrugFree Wayne County Partnership, and I'm also representing Indiana University East as a criminal justice faculty member. So we are very happy to talk to you today about the issues within Wayne County, and we hope that you learned something new that you may not have known before. And so hopefully you enjoy our talk, and we will be here afterwards with our live question and answer feed. So if you have any questions, concerns, or just want to chat with us, feel free to do so.
Okay, throughout our presentation, we will talk about the data for the national, state, and local opioid trends. We also talk about how our community is responding to the substance use disorders and opioids in Wayne County. We will also talk about the programming response for substance use disorders and opioids. And like Carrie said, we will be doing the Q&A at the end of the presentation.
All right, so I'm going to start off here kind of giving y'all a little bit of background about some data with our state in general. And then I'll be kind of moving it down more towards the county level. So overall, this is kind of our breaking down of our number of overdose deaths involving heroin and opioids for Indiana residents over the last 20 years. This data comes from the Indiana State Department of Health, so y'all can see everything that has been going on in our state. The preliminary data shows a small drop in 2019, but the trends are starting to tick back upward, especially now with COVID and issues with substance use disorders that are kind of becoming more apparent. So this is also kind of our, kind of breaking it down again, Indiana compared to the United States. As you can see, Indiana is higher in age-adjusted death rates, age-adjusted opioid overdose death rates, and as we're also higher with our prescription rates in Indiana compared to the United States as a whole. And then when you bring this down further to Wayne County, it's kind of the same thing. Wayne County is worse as far as our death rate, our opioid overdose death rate, and our prescription rates in the county. We are starting to go down, particularly from 2016 on, due to new programs like Inspect and stuff like that. So it's kind of getting better, but then obviously, as we said before, with COVID going on right now, we're gonna see an uptick in these sorts of overdoses just because of what's been going on with the pandemic. So now this is some information for Wayne County in general. So this is taken from NORC out of the University of Chicago. And so essentially it's kind of showing our overdose mortality rate. And this is from 2018. Our overdose mortality rate is actually much higher now. It's about 133. So it is a lot higher than this, but this is just kind of to show you what we are compared to Indiana, which is 34.3, and then the US overdose rate, which is 27.1. So Wayne County is quite high. And really our population in Wayne County really isn't that great. Like we're just a small county within Indiana. So this type of number for us is pretty crazy. Like it's something that we don't want to have. When you look at some of the risk factors that we have in our community, we do have some shortages as far as mental health practitioners, primary care practitioners, having bupe in our community. You know, we have some things that are there to help people, but at the same time, we could definitely use more. And the providers that we have are really great providers, but it's just we need more for our community, especially to address this issue. And as you'll see down here, I find this especially interesting. You'll see our overall prosperity index, which is kind of factoring in economic risk, social risk, our resilience as a community. You would think 4 is good. It's like, no, the higher you are on this scale, the worse off you are. So the fact is that our county is significantly worse off with a lot of risk factors than other places in Indiana and the United States. So these are things that we need to work to address, not only as Drug-Free Wayne County Partnership, but also within the state of Indiana, really. So that's why we want to do stuff like this to bring awareness to these issues. And I kind of highlighted NORC's data. This is from 2014 and this is from 2018. You can see that Wayne and Fayette are like 2 of the main counties that have the highest issues. So that's why symposiums like this are very important. And then this is the final thing I wanted to talk about. This is our first responder Naloxone Administration. This is just for 2020. So we've only had 8 months in 2020. So you can see this is the state of Indiana as a whole. So we have Fort Wayne, South Bend, Gary, Indianapolis. But then you can see right here with Richmond, we have quite a little hot spot going on. This is Wayne County. So again, you can see Richmond. And then these are the specific areas in Richmond where naloxone has been administered by a first responder. So it doesn't necessarily mean an overdose was happening in that situation, but it just means that Narcan was administered. And we actually had 3 Narcan trainings this month for Recovery Month to kind of help address that. But Wayne County is 21 per 10,000. So that rate is quite high. So that's something we really hope to change in the future and to reduce. And now moving on to Megan.
All right, so Carrie gave us all the data about Wayne County, and I'm going to go into what Drug-Free Wayne County Partnership is doing at this point to help combat the opioid crisis. I'm going to give a little background of who we are. We are the local coordinating council for Wayne County. Every county in the state of Indiana has an LCC, and the LCC is in charge of putting together the comprehensive community plan. During this, we meet with our coalition, and we have our coalition identify the risk factors and protective factors based off of the data that we get from the county and state that Carrie just shared. And based off of those, we create goals for our county. And then we have to submit our CCP that we created to CJI in Indianapolis. And they make sure it's okay for what we have planned for Wayne County. And then we track the data for 3 years just to kind of see what changes have occurred and if we need to make any changes in the process. A big part of the LCC is that we house the county's mini grants through the countermeasurement fees that we receive from the courts. There are 3 categories that we provide funding for, and that's, I guess let me back up. For our CCP, we focus on 3 areas: the prevention, treatment, and law enforcement areas. And on those, based off the data, then we're able to identify our needs, and then we open our grant cycle up for our community partners to apply for. And so this year, we each category received right around $16,000, and we actually funded 19 of our community partners focusing in these 3 areas. This is just a snapshot of what we kind of fund through the mini grants through the LCC. We focus on evidence-based prevention programming, like for the Boys and Girls Club, Life Skills, Too Good for Drugs. Also, like purchasing updated materials through Centerstone. They purchased the Living in Balance and Relapse Prevention curriculums. We also support sober community events with a few of our funded partners, just fun activities that individuals can go to and not feel that they have to be around substances that will trigger them to relapse. Another one is we offered funding for scholarships for equine therapy. that focuses on building up the self-confidence and healthy alternatives for the youth. And we also sponsor some of the canine programs through our law enforcement, Wayne County Sheriff's Department and Richmond Police Department. And they focus out on reaching out to the youth and like building the relationship with the youth, and as well as patrolling. A big part of the LCC is that we are starting to create work groups. And the first work group that we do have is the End Stigma work group. It's created to bring awareness to our community, to like educate our people the correct words to say, or how to approach somebody, or how to help somebody in need and not be a negative Nancy for them. We plan community events such as overdose awareness. Last year, as you see in this picture to the right, we did the Raise Your Hand campaign, where each handprint identified with a certain area of like if you were a survivor of overdose, if you lost a loved one, or if you have been affected by overdose in any way. And anybody is welcome to join. We would love to have you. So if you would like to join, just reach out to us after this or shoot us an email. Another thing that we are doing is Dr. Meyer over here spearheaded the Wayne County Recovery Cards Project. Would you like to talk about it?
Yeah, I can talk about it a little bit. So basically, this project was something I discovered from NCAD, which is the National Conference on Addictive Disorders in Denver, Colorado. And they funded a coalition for opioid use disorders out there, where they made these awesome cards from those in the recovery community and artists, and they put them out there for free. And I was like, this is so cool. I want to bring this to Wayne County because obviously our need is great and it would be so beneficial. So we started working on it this year, and this is our first effort that we've produced through our wonderful grants from Reed Community Health Benefits and through IU East. They graciously gave to us to allow us to do this. My students produced half the cards. So some of these cards are student made, which is really cool. And some of them actually went out to the recovery community and were able to talk to people about what they would like to see. So this is what was put into that, which is exactly what we wanted to do. So our first effort is 12 cards, 50 cards each. So we have a total of 600 cards that we hope to distribute to the community. Right now with COVID, it's a little difficult, but we hope for a physical release at some point. But obviously right now we're just working with our community partners to at least get it out there and at least get it seen. And obviously symposiums like this help us do that.
Yes, and they are free of charge. So if you are interested in wanting to get a handful of them, reach out to us so we can meet at the office, and I can get you some cards. They're free, and as long as they're used for outreach, that would be great. And one last thing for the LCC side of things, we receive the Drug-Free Communities Grant, the DSC grant. It is a federal grant. It focuses on youth substance use. It provides grants to community coalitions just to like strengthen the infrastructure and to build up that sustainability so we can continue moving forward with reaching our youth and then bettering the future for the children of Wayne County. It is a 5-year, $625,000 grant. And with that, it is 100% match. So we get $125,000 a year from the federal government, but our community also has to match $125,000 each year. And so that allows for buy-in from our community and building the sustainability for what we need. The DFC focuses on 2 main substances here in Wayne County. And right now, the 2 highest substances used in Wayne County for our youth is alcohol and marijuana. So we have been doing campaigns and trying to work with individuals to get the word out and how we could help our youth in Wayne County. We actually hired a youth coordinator back in December, and Tim Pearson had everything going, and then COVID hit. So he has been working diligently on getting a youth coalition going. And he's actually making waves right now. There's stuff on our social media. We're trying to get it. Ideally, we would love to have a coalition at each of our junior, senior highs in Wayne County. But right now, we're just trying to get a core group of kids that can be like the ones that spearhead the Youth Coalition, so then we can grow from there. And the big thing about the DFC grant is it does involve 12 community sectors. So there's 12 different sectors throughout our community that have to be involved. That ranges from youth serving organizations, churches, civic leaders, businesses, youth, parent, there's a whole healthcare, law enforcement, there's a whole bunch of them. So it is required for us to have all of those involved. So that encompasses the whole entire community as a whole. Future endeavors for the LCC, we will obviously continue supporting the local organizations in the treatment, prevention, and law enforcement fields. We have applied for our own 501c3 status, but COVID hit, and so it's kind of pushed things back. So it's going to be a year next month that we've applied. We're still going to continue building our relationships with our partners, and we're going to create more work groups tailored towards Wayne County's needs. Oh, I kind of already talked about that. So yeah, we're building the Youth Coalition. So if you see anything, or if you know of any youth that would be interested in helping with the youth prevention part of it, reach out to us or Tim Pearson. That would be great. Just share the word.
It's so important. We needed to share it again. And then lastly, we're going to be talking about one of our programs that is really starting to take hold in Wayne County, and it is one of our funded partners, which is the Cert Choices Emergency Response Team. So Megan, go ahead and speaker away.
Thanks, Carrie and Megan. So as Carrie kind of focused on the data and then Megan focused on what's being done in the community, I'm more focused on the intervention side. So again, my name is Megan and I'm the project manager for the Choices Emergency Response Team, better known as CERT. CERT is a team of specialists who are available 24/7 to the communities to provide immediate response to individuals who are struggling with substance use, mental health crises, and anything related to opioid overdoses. Our program was put in place in April of 2018 to kind of target those areas that Carrie was talking about that have higher rates of overdose. And so we're grant funded through the Division of Mental Health and Addiction, so our services are free. You can go on to the next slide. So currently on this map, you can kind of see that right-hand corner there near the tri-state area. So in April 2018, we started with Ohio, Switzerland, Jefferson, Ripley, Dearborn, Decatur, and Franklin County. And then as of October of 2019, we moved into Wayne and Fayette County. Go ahead. And so what does Cert Services look like? So currently we have a team of 5 licensed clinicians that can meet with clients to kind of determine that level of care and ruling out any mental health, substance use that we need to focus on moving forward with their treatment plan. We have 10 recovery support specialists who are a unique asset to our team just because they have that lived experience and our clients really gravitate towards working with them. We also have 2 RAP coordinators for more intensive cases that individuals might need help with. They just do more of working with other providers in the community to kind of bring this team around this client to help them. And then we also have a nurse on our team who is trained to provide traumatic brain injury screenings. And so basically, since there's such a correlation between substance use and criminal activity and just being involved in the system, we use that data to kind of pass on to the rehab hospital in Indianapolis, and they'll follow up with services for our clients that way too. So kind of what it looks like when someone calls our hotline, anyone can make a referral, and I'll go over that on the next slide. But really, we have that line that's available 24/7, so there's always someone available to answer the phone. And when they call, we'll get as much information as we can. It'll be sent out in an email to our team, and then a clinician will assign themselves and then assign a recovery support specialist. If it's an emergency, we can be there within an hour. If it's non-emergency, we respond within 24 to 48 hours. And our whole goal is just to meet the individuals where they are. We recognize recovery looks different for everyone. And so we really encourage our clients to have that autonomy to make that decision for themselves, what they want their recovery path to look like. And so we can link individuals to inpatient treatment, outpatient treatment, harm reduction, medication-assisted treatment. If they just want to work with a recovery support specialist, we can do that. And so it's really just empowering the individuals and their families to look at long-term recovery and making sure they have those resources in place, and just doing whatever we can with the community, whether it's involved with DCS and supporting them in that way, We go into the jails to help individuals and making sure that when they get out, they have those resources in place so we reduce that risk of relapse and overdose. So like I mentioned earlier, anyone can make a referral to our hotline. Our services are free of charge since we're grant funded. And so examples of our current referral sources include self-referrals, DCS, family members, law enforcement. We get a lot from the hospitals and attorneys, and then any mental health centers. So if they have someone, for example, that they're working with that's on Suboxone and they're just still struggling to meet some of those community needs, we can help get things in place like food or transportation and things like that so they can maintain this recovery plan. Okay, next slide.
Oops. I was just gonna say.
That's okay. So if you want to make a referral to CERT, like I said, that hotline that's available 24/7, that number is 317-205-8302. And that's the gist of what we do. So thank you.
Well, thank you for that presentation about the work you're doing in Wayne County amongst your coalition. Are you all joining us today, or one from your organization joining us this afternoon?
Yes, I'm here.
Hi,
All
Megan.
three.
I'm here as well.
Wonderful. Well, we'd love to open up this opportunity for questions from the audience about any of the wonderful work that you guys presented on that you're doing there in Wayne County. While people are taking a few minutes to type in those questions or to find the unmute on their phone, just want to remind you, if you do need to leave us early today, that there is a post test that we would ask you to complete for evaluation purposes. And that link will be in the chat window as well. Trying to give people a few minutes here to put in some questions. Dr. Anwar, do you have any questions for this team?
Just one question. I think all the information that you provided had a lot of information that anybody can ask you from. I just was wondering that you mentioned the work groups and the End Stigma work group. How can the community members get involved with that?
So basically we're trying, we put out our meeting information every single month, and our meetings are open to anyone that want to join. So we basically just try to put it out there for anybody who wants to join any of our work groups, including the stigma work group, to just contact myself or Megan, and we will get them hooked up with what they need to.
Thank you. I think it's very important to get the community buy-in when we're talking about stigma, especially because with this, there's a lot of stigma associated with mental health. There's a lot of stigma associated with substance use. I know that you've done a lot of work, Dr. Mier, on stigma, and you did also a presentation for us on ending the stigma. So, and then there's a lot of stigma associated with treatment itself, especially in rural communities. So that's a great work that you're doing out there and eliminating the stigma, and we would love to collaborate with you at any level possible through InROC. But kudos to you. And then CERT, I just wanted to just give a shout out that it's an amazing program that provides that resource, which is so much necessary in rural communities, especially when you're talking about where we have lack of health providers, we have lack of mental health providers, we also have lack of addiction treatment services. And then on top of all of that is transportation, which is the biggest issue in rural communities. So the number that you shared for CERT, we will be also sharing this information with all the participants. I think that's a great opportunity to access treatment, especially in the communities where there's a huge lack of this access. So thank you so much. I appreciate that.
Thank you.
I know we recorded your presentation a couple weeks ago, and in the ever-evolving times that we're in, are there any new updates or any new or next meeting dates that you'd like to highlight for those who are listening in today?
Our next partnership meeting is on October 1st, so next Thursday. It's always the first Thursday of the month, and it's going to be virtual, and so we'll have the link. We'll send the link out if you're part of our email, our mass email that we send out each month, and then we'll also post it on our Facebook page with the link on there for the Zoom. And for the rest of the year, we will be all virtual. So, and like I said, all of our meetings are on the first Thursday of each month, and anybody is welcome to attend.
Wonderful.
Yeah, and for Recovery Month, we've been doing everything virtually. So we have videos on our YouTube channel, social media. We have 2 more naloxone trainings that are being offered with InROC and the Center for Rural Engagement. And those are tomorrow from 12 to 1 p.m. and also Monday, the 28th from 5 to 6 p.m. So they're really great training opportunities, especially to address this issue. So definitely feel free to come check it out and to learn more.
Wonderful. And we just got from Kathy in the chat that QSource would like the contact information for attending those. So we'll make sure to connect the 2 of you so they can be QSource can be more involved with your group.
Yeah, definitely. Yeah, we're looking for any
That would be great.
input. Yeah.
Wonderful. Well, thank you, and Kathy will get that, and we'll connect you all probably tomorrow together. So thank you so much for joining us today, and thank you for all the work you're doing in Wayne County and the surrounding communities.
Thank you.
Thank you for having us.
Wonderful.
And thank you.